So we want to get you caught up on the latest coronavirus news.
The United States topped 99,000 cases on Friday. That's the highest one-day total ever. And at least 31 states set single-day records as we surpassed 9 million cases as a country, Al.
Yeah, so now, Craig, you factor in the election tomorrow. A lot of folks are dealing with a lot of extra stress.
It is so true. So we want to help this morning. Here to help answer our questions is NBC News medical contributor Dr. Natalie Azar. Good morning to you.
Morning, Chanel.
I was just looking at the numbers of people who are going to YouTube to try to meditate. I mean, everybody's looking for something. The numbers are staggering. Over the weekend, Dr. Fauci told the Washington Post that the U.S. is headed for, quote, a whole lot of hurt. Why do you think we're experiencing such a resurgence here?
You know, Chanel, it really is a perfect storm of things. We have a combination of pandemic fatigue. We have indoor gatherings. We have reopening of businesses, sporting events, things like that. Yes, some modelers are predicting that we're going to have around 2,000 deaths per day by the end of December. But this is not set in stone. And public health measures really can reverse the trends. People need to adhere to guidelines, masking, social distancing, and there needs to be aggressive isolating and contact tracing in communities.
You know, Dr. Nat, I was wondering, because over the weekend, British Prime Minister Boris Johnson announcing a second lockdown, other European countries like France, Italy, all following suit. Can we avoid this? Because that's the thing. Everybody wants to avoid that lockdown.
Exactly. Well, look, a lockdown is a short-term fix. It is not a long-term strategy. Unfortunately, in the last 2 weeks, we had a 25% increase in hospitalizations and a 16% increase in deaths. This can overwhelm hospital systems. We're already seeing that. So in those scenarios, could I see a short-term lockdown being implemented, just to really flatten the curve again in those areas regionally? I do think that's a possibility now.
Dr. Natalie, I want to ask you about Thanksgiving. I mean, we've kind of added my in-laws to the bubble for a while now. We've all had coronavirus at some point in the last several months. We were planning on spending Thanksgiving together, but they do technically and do live in Massachusetts, which is now a quarantine state. I mean, so does that mean family is off? I mean, what are the rules for getting together for the holidays?
Yeah, Dylan. So basically, the CDC has a gradient of risk. Low, moderate to high, just like they did for Halloween. And as you can imagine, the lowest risk activities include having a small dinner with just your household members, all the way up to the highest risk being an indoor gathering with people outside of your household. One thing that I also thought was important that they mentioned again is shopping. You know, Thanksgiving is a big shopping day, Black Friday, I should say. Online shopping is safer than going into a crowded store. And one thing that I thought was really nice in the low risk activity is to make a traditional Thanksgiving recipe for a family or a friend and deliver it to them safely. I thought that was a really nice idea.
That is a good idea.
So, Dr. Natalie, in addition to this pandemic, oh, by the way, there's an election here in just a few hours, and Americans are worried. In fact, according to a survey by the American Psychological Association that was conducted last month, 72% of Americans list this election as a source of their stress. 72%. So walk us through some of the do's and don'ts of managing our stress.
Yes. Okay. So, Craig, let's start with writing down what is stressing you out. Experts say that writing these things down, identifying, processing your negative emotions can actually help to alleviate anxiety. If you have the time, try meditation if you haven't done before. There's been a significant uptick in people downloading meditation videos. Then there's something called the relaxation breathing technique of 4, 7, and 8. I don't know if you guys have ever heard of this, but it's essentially you take an inhalation, you count 4 seconds in, you hold your breath for 7 seconds, and then you allow 8 seconds to exhale. Kind of feels a little bit like yoga breathing, but it really, really, really can help. And lastly, you want to limit exposure to the news. And I know that's hard for us in the news business, but I would recommend, for example, check out the headlines, maybe every hour, every other hour for about 5 minutes, see what's going on, but don't keep it on in the background all day. And then, of course, I know this feels really logical and intuitive, but sleep is incredibly important during this time.
And the things you do actually just as important, the things you avoid. And what are some of the things to avoid to reduce stress as we go through these next several days?
Okay. So yes, so talking about a short-term fix is not a long-term strategy. We definitely put alcohol into that category. So try really during this time, not even just tomorrow, but in the days and potentially weeks to come, to limit your alcohol intake, limit your sugar. Use less caffeine. Caffeine is a stimulant. If you're already feeling anxious, you don't want to overdo it. And then avoid this thing called doom scrolling. I did not come up with this term, but I think it's brilliant. It's basically you're on Twitter, you're on Facebook, you're on Instagram, you're on social media, just going down that rabbit hole with, following people who are potentially increasing your anxiety. Not a good place to be. Put your devices away.
It's true. Good advice. Have you noticed sometimes you scroll, put it down, and then you pick it right back up again?
Yeah, mindlessly.
Doom scrolling, though. Wow.
It's really bad. I mean, it's our mind. We've become so addicted to it. It's another segment.
Azar, thank you so much. We're going to try that breathing technique. That was a good one. All right.
Did you hear Craig try it?
Yeah.
Yeah, that was real heavy. That was some heavy breathing.
Well, he's got
wow.
stress.